My name is Michael Lichtenstein. I'm the President and CEO at Wood River Health Services. Community health centers started about 50 years ago, and the federal government funded 2 community health centers basically to provide primary care to individuals who had no access to primary care in their communities. We now have about 1,200 health center organizations across the country in over 9,000 locations. And it's about 153,000 employees and close to 90 million patients. The mission statement of Wood River Health Services is to improve the health and well-being of our community by assuring access to affordable, high-quality health care, coordinated services, and health-related information. And and part of our vision, or vision statement, is that Wood River Health Services is working to strengthen our communities where the needs and concerns of our patients and clients and their family members are at the center of program decision-making and service design. Wood River Health Services is a nationally recognized patient-centered medical home. And what that means is that we put the patient and his or her family at the forefront and attempt to wrap services around the patient, the family, and what their needs are. So our focus is meeting the patients where they are, understanding what their healthcare needs may be, and helping them to develop an effective treatment or service plan for themselves or their family members.
So what I think makes Wood River different from a lot of other doctor's offices and health centers is that we really have the needs of the whole community in mind. We are meeting people where they're at, so not only just seeing them when they're here in their doctor's visit, it's really more about the team approach, which is part of what we call patient-centered medical home. So we have, for example, we have dental here, we have behavioral health, we have a nurse care manager who will go out to a patient's home. So I've actually been a patient at Wood River since I was 4. When I finally got to medical school, what I really wanted to be is kind of that old-time country doctor, and I went away for residency, so I spent 3 years down in New Jersey, and when I was looking for jobs, I interviewed at Wood River, but didn't really think I'd come back home to do what I really had always thought I would do. But it's kind of cool because now I'm doing it in my hometown.
We really truly do have the ability to provide comprehensive care, across the spectrum. Our newest addition to our health center are the addition of behavioral health services and case management. And with the addition of the last 2 departments, we're really able to provide comprehensive care to patients of all ages.
My name is Sheila Capice, and I am a licensed clinical social worker here at Wood River Health Services. I am the behavioral health manager. I was happy to accept the position here at Wood River. I believe it takes a team approach in today's world to provide good health care. I'm happy because the medical providers are right around the corner, and we can work together to help patients, and even with the dental department here. We have community resource specialists that can help patients with things that I can't do from my chair, working individually with patients. But if a patient needs help getting housing or food stamps, or just needs some guidance on how to take their medication or manage their health symptoms, their physical health symptoms, the community resource specialists I can refer them to, and they can get that service.
My name is Dr. Tiffany Waldeck-Napolitano, and I'm a general dentist, and I've been with Wood River for 4.5 years. I think the thing that makes Wood River Dental the most unique is the variety of staff that we have. We all come from different backgrounds, both professionally and personally, and this really allows us to treat a vast multitude of patients who come from different backgrounds with compassion and with confident care. So with the Affordable Care Act, a large number of patients have gained access to dental insurance that didn't have it previously. The Affordable Care Act makes it mandatory that patients have, that all people have an insurance plan. And while the dental component has been voluntary, a great number of patients have actually opted into the dental benefit. which has made it possible for us to treat a large number of patients who weren't getting access to care previously, and we've been able to do a lot of good, relieving pain and improving the aesthetics and the self-esteem of a lot of our patients.
Hello, my name is Amy Babcock, and my family and I have been patients here at the Wood River Health Services for 11 years. The moment you walk in the door, the staff greet you with smiles. There's little to no wait. The nurses and the doctors are all very knowledgeable and so compassionate. When my family and I come in for an exam, the doctors and nurses are so welcoming and they're so warm and they make everybody feel so comfortable. Just before Chloe's second birthday, Chloe got really sick, and as a new mom, I wasn't really sure what to do, so I called at Wood River Health and they saw her immediately, and Dr. Manlove took one look at Chloe and sprung into action and found out that she had pneumonia and sent us right to the hospital and saved Chloe's life.
What WIC does is it helps to improve the health of nutritionally at-risk, low-income women, infant, and children. And WIC does is it provides nutritious foods, nutrition information, breastfeeding support, and healthcare referrals. A nutritionist is an expert in the field of food and nutrition. And as a nutritionist, I help to advise people on what to eat to develop a healthy lifestyle. And we help to accomplish goals, a health-related goal. And nutritionists are important because they help to improve the overall health and wellness.
For me, the best part about working at this health center is when I get out of my office. As the CEO, I get out to walk the halls and talk to staff and interact with patients. And the stories I hear directly from our patients, or when I see staff interacting and talking about the patients that they serve, there's nothing like it. The positive impact, the significant changes they're able to help people make, and I get to support that activity day in and day out. But it's really the work that the staff does here. That's what brings me here every day.
Folks come here to work because they want to be here. The other providers and the other folks could all work other places, but they've chosen to be here for a reason. And the reason, deep down I feel is that we really truly care about our patients, who we really truly want what's best for them, and we really put in the extra effort to provide comprehensive care to the folks that walk through our door.
We have great administration that really supports WIC and everything it stands for.
The best part about being a patient here is the friendly staff.
It's definitely the staff. I love the people I work with.
That it's a community health center.
It's really a sense of community.
My favorite part about coming to Wood River is that it always makes me feel better.